Hello everyone, my name is Dr. Aderemi for Mom Health Organization and you're welcome to our YouTube channel. Today we're going to be discussing about something that is really dear to our hearts. When I mean our hearts, I mean a mother's heart, and that's our babies. We're going to be talking about the management of common cold in our babies. First of all, who are babies? Let me differentiate. You cannot call your 5-year-old or your 6-year-old or your 7-year-old a baby. A baby is like a newborn. A baby is like an infant. An infant is defined as a child that is less than 12 months old. So you're not going to tell me your 3-year-old is still a baby. Your 3-year-old is already a toddler about to become a child. So getting that aside, we know who babies are now. What is common cold? Between you and I'm not going to talk difficult terminologies. Common cold is cold. When I mean cold, it means it's caused by a virus. We have different microbes. But when we talk about virus, bacteria, a virus is smaller. A virus is not necessarily deadlier, but a virus is something that usually takes its course in the body. So common cold is usually caused by viruses. And there are series of viruses. Even this coronavirus going about is also a virus, and it causes cold-like symptoms. So common cold can be caused by different viruses. The most important thing about the fact that a cold is caused by a virus is that it doesn't have a cure. So it takes its course within the body and then the person gets fine. So now let's go to common cold in babies. How do we know our babies have cold? Or first of all, let's start. How do our babies get cold? Cold is usually seen in the atmosphere as respiratory droplets. Okay, I'll break that down. What I mean by respiratory droplets is like you have somebody infected, the person sneezes, sniffs, the person coughs, and releases some things into the atmosphere. Those are called respiratory droplets. When our baby inhales it, or when we inhale it, is how we get common cold. It could also be gotten from skin-to-skin contact, and it could be gotten through kissing. And that's why I don't get angry when a mother says, please don't kiss my baby, because we don't know what's in your saliva. It might be cold, it might even be something worse than a virus. So it's important for babies not to be kissed by just anybody, especially even the mother. If she has flu-like symptoms, she shouldn't kiss the baby because these droplets are present in saliva. Also, by touching contaminated surfaces. And that's why it's important that around our babies, the environment is clean. Because if someone that has cold, sneezes, coughs, and then touches me, and then I carry my baby, baby can also get common cold. Now that we know how our babies get common cold, how do our babies manifest common cold? What are the symptoms of common cold? We know them. When somebody starts coughing around us, say, oh, don't come near me, you have a cold. Coughing, sneezing, even sniffing. Oh, you already know the person might have a cold. Another thing is nasal discharge, running nose, nasal mucus. Another thing that can manifest common cold is tiredness. You notice person has loss of appetite, fatigue, baby has malaise. The baby is not as active as before. Even we adults, sometimes people classify common cold as malaria because you are feeling down and you know something is happening. This is because the baby's body is trying to fight the cold. And that's why fever comes up, malaise is like general body weakness, fatigue, tiredness, loss of appetite. We can see this when our baby has a common cold. So I've classified cold-specific symptoms. Not really cold-specific, but between you and I, let's just say cold-specific symptoms. Coughing, sneezing, nasal discharge. Then other things that are caused by the body fighting this cold. Fever, malaise, fatigue. So now we know our baby has cold. What do we do? This is very important. Some years back, we have an organization called Food and Drug Administration. It regulates drugs. And they've already brought out a memo that children below the age of 2 should not be given cough or cold medications. I'll tell you the reason. The reason why when you come to the hospital and you say, oh, my baby has cold, and I'm like, don't do anything to the baby. Just leave the baby. We can't give the baby cough syrup. We can't give the baby this drug. It's because we've realized that these medications have certain things, I don't want to bore you with the names, that are harmful to the baby. And in the long run, the baby will still have the cold for the next 2 to 3 weeks anyway. So why do more harm? So what do we do? This is very important. And this is where I am going. What do? You leave the baby. Let the baby rest. When I mean rest, I'm not saying you abandon your child. You make sure the baby is warm, properly covered, especially the chest. You wear socks for your baby. You wear all those hand mittens if your baby is still very small and baby still wears mittens. You wear mittens for the baby. You wear cool caps for your baby. Ensure your baby is kept in a warm atmosphere. Ensure the place the baby is humidified. When I mean humidified, the hair is not like, harmattan hair, unnecessarily dry. The air should be properly regulated. You are not supposed to put on fan or put on air conditioning for the baby. Baby is supposed to be kept properly warm. You monitor your child's temperature at this point. I tell most of my patients, please get a thermometer. The reason I say this is because when you're at home, it's the easiest way to check your baby's temperature. And if the temperature is getting really high, the baby is feverish. Another thing you can do is you can tepid-sponge the baby. You just have to realize that fever is a normal response to common cold. And so if the baby has fever, you shouldn't be overly worried. But make sure the fever is not extremely high. So what do? You tepid-sponge the child, and you can give paracetamol. I say paracetamol in code because that's if you know the proper dosing and you're following the dosing guidelines. You're not supposed to just go and give the baby paracetamol how you feel like giving the baby paracetamol. The paracetamol will not cure the cold. The only thing the paracetamol will do is ameliorate the fever. Another thing you can do for the child is you can do nasal suctioning. You can remove the nasal discharge. I'm not saying you should use your mouth though, like most mothers do. There are usually like specified syringes to use to remove this nasal discharge. And if you cannot do it, please just bring the baby to the hospital. Another thing you can do for the baby is saline drops in the nose. This is usually to dissolve the mucus. Normally, even we adults, when we have cold, we have nasal plugs, mucus plug in our nose. You can help your child remove it with cotton buds. This is so as to enable the child should breathe well. These things clog the airway, and so when you remove it, the baby begins to breathe properly. Another thing you can do for your baby is ensure your baby is eating well, drinking well. Common cold causes dehydration. So if you don't feed your baby, if you say, oh, the baby is not eating, there's a problem. Even if the baby is not eating, the baby should drink adequately. This is to prevent dehydration. And if a baby is dehydrated, the baby has fever, another thing that could happen from there is a convulsion. And of course, nobody wants that for their babies. It's usually hectic for even we doctors. So I can imagine what a mother will be going through. If all these things don't work, they will actually, in 2 to 3 weeks, the cold will take its course. But I'm saying in case this doesn't happen, in case your baby starts to have respiratory distress, baby is not sleeping, baby has the nose flared up, you see all his or her ribs coming out, oh, my baby is not breathing well. If the fever is getting extremely high, you are feeling, you're seeing it recording a temperature of 38 degrees, a temperature of 39 degrees. If your baby has stopped eating, your baby is not drinking, please and please don't manage the common cold again. Please report to your nearest health center. Thank you very much. Thank you very much. Please don't forget to subscribe, don't forget to like, and don't forget to share this video. Also, hit the notification button to get more videos like this. You can also visit our website at www.momhealth.com.ng for all maternal and baby products. Guess what? We have a 10% discount for you for all purchases made on that website. Another good news we have for you is you could also visit Google Play Store and download the Mom Health mobile app to explore all our amazing features. Thank you very much.